Hey, this is the Masters 24. I am here to give you the treatment options for depression. Now, in my last video, I spoke on the signs and awareness of depression and where to go, and also the hotline number to contact someone if you're really having really bad depression that you really need to talk to somebody. But in this video here, I'm gonna give you 5 steps on treating depression and how to deal with certain situations dealing with depression, and basically just getting the support that you need. So we want to go straight into it. Step 1, seek professional evaluation. A licensed therapist, psychologist, or psychiatrist can provide a diagnosis and suggest best course of the action that you're seeking. So if you're going through a really deep depression, then I would suggest for you to seek somebody that is great in neuroscience, because most of the time we don't really know why we act that certain way, but they can tell you more in depth about what it is that you need to know, and they will help you in the process of getting the help that you need. Now, there's going to be times where as though you just want to talk to a therapist, you just want to have somebody to listen to you and you want to tell their story to, and that would be the option for a person to get better at understanding why they go through the things that they go through. So there's different options of seeking professional help. I would definitely suggest that, just keeping that in mind. Now, step 2 is kind of going back to step 1 about the therapy. Now, this one here, I would say explore psychotherapy, just talk therapy, just somebody that can actually just understand you. The more you build up your story, build up your case, the more they understand you and they can give you their suggestions of what you should do and deal with this depression. Now, I would say cognitive behavior therapy is one of my personal opinion, the best one, because they actually get to help you reframe negative thoughts. Now, that's something that everybody, I believe personally, should get yourself into, because it actually rewires you to understand that life is perfectly fine, and you have to understand that you are not alone. And I think the one thing about depression, to me, I feel like, is that everybody think they're alone at some point because of whatever it is that they experience in life. But with the cognitive behavior therapy, they have this thing where they can kind of reframe you into believing that, not even believing, but showing you a better way of living. Now, interpersonal therapy is a little different. It talks about relationships issues, and I mean, I don't really need that personally, but I'm sure there's a lot of people that actually need that as well. So I would suggest that if you're having issues with, being in a relationship, not understanding why a relationship acts a certain way. So I would definitely go for that as well. And dialogical behavior therapy is something different as well. It just pretty much teaches emotional regulation and stress. It's more so if you're having these episodes and you're not understanding why you're having these episodes, they would give you more of an in-depth feel on why you're feeling this way. And sometimes it results of, treatment for us, like medicine or anything like that. I personally don't want to do the medicine route. So that's why I say the cognitive therapy to me is way better, especially if you already trying to seek help. They would definitely get you on board on whatever it is that you're going through. So that is step 2. Now, everybody go through their episodes, so to speak. And step 3 is something that I personally don't like because of the medicine business and everything else like that. I really don't want to get deep into that. But I still want to consider this because some people actually may need it. So I would just consider medication, but under, medical supervision. It's kind of hard to suggest this, especially if you're just needing someone to talk to. But like I said, antidepressants such as SSRIs and SNRIs, it may help regulate your brain chemistry, meaning that, basically they would try to, like, that medicine would pretty much like make you feel more happy, make you feel more relaxed, depending on what it is that your issue is. Now, it's always good to follow up with doctors as well for guidance, discussion, and effects if it's affecting you in a certain way openly. I would do that only if you feel the need to, but I would talk to your doctor first and see if that would be a great option for you. Step 4 is something that I personally highly recommend, highly recommend, and just incorporating lifestyle changes. Do something that you normally don't do that will open up your mind and exploring different options. Also, regular exercises, 15 to 30 minutes a day can actually help improve your mood, because now you're actively moving, your blood is flowing, everything is good. You listen to your music, and you might meet some, good people. So I would suggest that. And just also, maintain routines and prioritize sleeping. That is really important. You have to rest, definitely have to rest, and eat balanced meals. Just try to be more health conscious, so to speak. That also can change your mood as well, because now you're feeling great about yourself. You're feeling open and inviting, and a lot of people can see that. So if you're depressed, a lot of people can see that as well. And most people won't feel sorry for you if you're depressed. That's why it's great to change within yourself, and your mood will also open up to other people to see. Now, it's not just about opening up to other people. Don't get me wrong. I don't want people to get the wrong idea, but it's for your personal mental health. So this is pretty much what all this is about. I don't want anybody thinking that you got to change for people. You change for you yourself. So that is step 4. And step number 5, last but not least, try to support groups or peers counseling. Now, this is a big deal for me because I am open enough to want to have something like this. And eventually I do want to have an open forum, a group, or, something like that in that nature, to talk about mental health and talk about especially men's mental health, women too. And we can just have a dialogue on helping each other and growing with each other. I think that's the most important thing, because nowadays it is really alt-seek, meaning that everyone is not knowing that they need this. And we have to figure this out, because it's getting worse and worse by the day. So I would like to help the people that want to help themselves, that is open to want to be more open to greater things in their life and just want to change, change for the better. And I think that's the most important part about this whole segment that, I'm spurring out, is just that I want people to do better for themselves. Share, your information, share our information to everyone else that they know that needs help. Talking to others who understand can reduce isolation and increase hope. So that is something that we can also relate to. It's just that we need that hope. We need that feeling. We need to be more of a group of people that can change the world within ourselves. So that is the most important thing about this whole segment. I love it, and I want to see everybody grow and do better for themselves. Seriously, I really do. So let's try to do something different for our lives for a change. I also want to speak on the stigmatization effects. That is pretty much something that I want to get into lastly, because that kind of talks about everything else that I spoke about before. Just the name a few: normalizing conversations, use respect, not judgment languages, educate yourself and others. So it's like, this is something that I'm personally doing already myself. So that would be my last segment on this depression thing. Now, I want to speak more about depression and mental health in the future. If you like, just let me know. I would definitely be open to it. But anyway, this is my segment, and thank you for watching. I'm out. Take care. Thank you.